My name is Dr. Oscar Baishimori. I'm a personal development life coach that specializes in sharing information, strategies, philosophies, and life skills that empower people to live above mediocrity in every area of their personal life. Today, I want to emphasize on something very significant as we can see that there is urgent health crisis in our society today. Is visible to the blind and is audible to the deaf that there is huge crisis in our hands in the health sector. I remember sometimes few years ago in the last administration of Muhammadu Buhari, when there was a publication that about 143,000 medical doctors migrated from Nigeria to United Kingdom alone, UK alone, within a space of 9 months. This was reported in many newspapers, blogs, and all the media. This does not account for those who went to America, Canada, and other countries, but to the United Kingdom alone. And the consequences look speculative then because it doesn't really look like something we feel connected to. But currently, let me highlight what is going on based on what my loved one experienced and what I personally experienced. There are reports, of course, there are evidences visible even to you and other people where you see somebody who just not feeling well. It's not just feeling well, and he drives himself into the hospital. And somebody who drove himself into the hospital, but from there he ended up in the mortuary. It's not one, it's not two, it's many instances. And it is very clear currently that medical help is practically out of reach of the ordinary people. You know, I remember when I reacted to this news, that time I made a video. Currently now we can connect with what is happening. If you go to any hospital now, including private hospital, you will see that the hospitals are overstretched. You will see countless numbers of people in the hospital waiting to be attended to. The funniest thing is that there's going to be only very few, 1 or 2 persons attending to numerous number of people. Currently, when you have an appointment with hospital, you are going to spend hours, such that when you have emergency, you are not close to getting help as at when it is needed. What am I trying to say? There is huge shortage of personnel. And one of the reasons why the cost of medical help is not within the reach of ordinary people currently is not unconnected to the laws of demand and supply in economics. Definitely, when there is demand more than supply, cost will go up. Yes, cost will go up. So no matter what is done currently, if it does not include having more human resources in our health sector, we're going to have more demand than supply, and that is going to drive cost of medical help very high. Currently, the cost of medical help is very high. I have been a wellness coach, sharing information about products that help people improve the quality of their life. This I've been doing for the past 15 years. I'm not a medical person. I'm an engineer by training. I'm an environmentalist and have been a social crusader. Somebody who is passionate about improving things, making things work better, improving the life of people around me, helping people gain advantage. I'm not just limited to working on improving my health alone. It's something that I get inspired sharing information, strategies that can make people function better, improve the quality of their life. Or like what was said by Zig Ziglar in one of his books, that it is going to amount to wickedness if you have an information that can empower your fellow man and you decide not to share it. So I am into the sharing economy where we share information that help people to improve the quality of their life.